Okay, so hello everyone again. You have already seen me, and I made a presentation in the afternoon, but I think it makes sense to refresh your memory. So I just go through again this research on civil society involvement in these 4 countries: Finland, Ireland, Greece, and Hungary. And we are lucky to have people from the aforementioned countries here. I think we have Ireland, we have Finland, and we have Greece. Yeah, we have Greece. Good. So we have Hungarian. So we can, after I summarize you the findings of this study, we can have a discussion together about how we can benefit from these findings and how we can move things forward, especially in these 4 countries. But if you are from other countries, I'm very happy if you can add your experiences, your own experiences in your countries. Like, how does civil society involvement work? Does your government speak to you? Do you feel involved? Do you think that governments take serious what you say in drug policy issues? So, as I mentioned in the morning, this study was conducted by Correlation Network, and it was based on this document, the Quality Standards of Civil Society Involvement. I really recommend you to have a look on this document if you want to move forward civil society involvement in your own country, because this document is kind of reference point for both decision makers and civil society. So if you are not happy how civil society is involved in your country, you can point to this document. You can just say that, yeah, you know, this is the process. It should look like this, and these are the criteria you have to fulfill in the country. And you can see that's what is missing from your countries. And so we organized the 2 focus groups discussions in each of these 4 countries. It was from June to August this year. Decision maker and civil society focus groups, and we mapped the different kind of drug policy mechanisms and structures in each of the countries. What structures exist, and of course this will be published as a report. We hope that, Hannah, is it like maybe next week or the week after, or yeah, but very soon it will be published, the report. Now it's in the hands of the designer, so it's like in the very end of the process, and you will be able to read it. We have like different structures in different countries. In Finland, you don't have any body to include civil society, like no formal mechanism, but civil society has its own network, and in this network they created a so-called drug policy working group, which meets time to time. And this Finnish Institute for Health and Welfare, someone from that institute is attending those meetings, and there is some kind of dialogue, which I would not call a formal involvement of civil society, which was, for me, just a personal note, it was for me a bit surprising, because I expected that in Finland it will be like a formal mechanism to involve civil society, but there was no. And of course there is always the local level, you know, in the city level, and the city level usually have their own mechanisms, so their own mechanisms to talk to civil society. And in Ireland, as I mentioned, they have this very advanced structure, and they have some formal mechanisms to involve civil society. This is the NOC. This National Oversight Committee was created together with the new drug strategy, and that is in charge of implementing the drug strategy, and it has strategic implementation groups, right? Yep. And in these groups, each of these groups, there are 3 civil society representatives sitting there and making the decisions together with the ministries and civil societies, civil servants. So it's like formal mechanism, and apart from this, they also have this experience with the Citizens Assembly on drug use, which is, I think, unique. I think there is nowhere else in the world. They had citizens' assemblies about other issues before, and I think that's something also for us to discuss whether it can work in other countries. Because I think it's a very good idea how to mobilize people, how to involve the general public more into drug policies, because it's like really like people from the street, random citizens are sitting together, they meet regularly, and they have the opportunity to listen to presentations from professionals, people with lived experience, and for example, there was discussion on decriminalization, as I've heard, very productive discussions, and sometimes when people are educated, they can make good decisions. I mean, the problem is when they are not educated, and this process guarantees the education of people. In Greece, again, they have some kind of structure of drug coordination, but unfortunately civil society is not much part of it. So they have different committees, interministerial committees of coordinating drug policy. And they have a national drug coordinator, and the national drug coordinator has an advisory body, and one person from civil society is sitting there. But actually, again, just like in Finland, I wouldn't say that there is a formal involvement of civil society, or there is a dialogue, and of course there was a disagreement between the government and civil society whether how fruitful is this dialogue between state agencies, because in Greece, our colleagues can talk about it hours, I think, if we ask them, but now I don't ask, but in Greece, you know, the main service providers are state agencies. So there is Okana and Kitea, and all these agencies are actually state agencies. And it's not NGOs who are providing many services, but directly these state agencies. And then these state agencies have some connection to the civil society organizations. So in Hungary, we had a very good system, actually. Like before 2010, we had a committee. Come, you are welcome. At least some people didn't go to the mental health. So then we had this National Drug Coordination Committee, and there were 3 civil society representatives who were elected by the civil society. So we were electing representatives to the governmental body. We were sitting together with the ministers and things. So that was a very good system. Yep, please. And but this system was abolished by this current government. So now there is no real body to discuss things with civil society anymore. And about the findings, so that there is no formal mechanism with decision-making power in these countries except Ireland, and actually most of the civil society representatives who were in the focus groups, they said that it is usually informal channels how you can influence drug policy. It's not the formal channels. So you have to make some lobbying, direct lobbying. You have to go to open the right doors. You know, you have to know who to go to. For example, in Greece, someone said informal behind the doors lobbying is the easiest way to achieve things. And actually, you know, all these countries where we did this research, they are relatively small countries. With relatively small population size, like Ireland has 10. Ireland has like 10 million people. How many people? Yeah, 5. Yeah, so it's a small country. Finland also has like 5 million. Actually, Greece is a bit bigger, right? How many you have in Greece? How many people do you have? 11 million, and Hungary has 10. So it's all of these are small, relatively small countries. So the drug scene is also very small, actually. So people know each other personally. It's not like a big country like Italy or Spain or something. So maybe that's why we had this finding that the informal channels are very relevant, because everybody knows everybody. Sometimes I can even joke that it's like a family, but a dysfunctional family. So it's like really like if you go there, and these focus group discussions are also good to see that, to show that there are stories in all countries. There are stories where how we got here. You know, there are, and there are always people behind these stories. You know, there are personal alliances, friendships, and conflicts. So it's very important, I think, how this developed in each country. And sometimes one person can really have a big influence from both sides on processes. About transparency, yeah, it was even in like, you know, Finland, which is regarded as a very transparent country in terms of financial things, and it was said that, you know, like most organizations work according to the book, so there are not so much infringements in this term, but at the same time decision making is not very transparent, so that people have no idea how real decisions are made, usually made behind the door. So you don't really have an influence in that. So, and even in Ireland, where, you know, there is a formal mechanism, people said that sometimes they were just presented with what someone decided already. So it was just, you know, rubber stamping decisions that were prepared before by the government, and that created a lot of frustration in civil society. And yeah, as I mentioned, someone said in Finland that if the government would work more transparently, they would be exposed that the policy is not evidence based. And yeah, the approachability, that how approachable civil servants are, there are gaps, and it was interesting to see that, you know, there are NGOs with greater resources, and they usually have someone to work on advocacy issues, and they have maybe some resources and some know-how how to deal with politicians and civil servants, and they have some connections, and they can get connected to the government. But there are also civil society organizations that have not so much resources, and for example in Greece especially, it was mentioned that the community organizations are often not able to communicate with the government and state agencies, and they are not taken seriously. So yeah, depends on who is asking. And the competence was, again, it's very interesting, you know, like how the governments see competence and how civil society sees competence. The governments think that civil society does not understand how decision-making works. So it came back in all countries that, yeah, these are smart guys, they know a lot about drugs, but when it comes to how we work as administrators and civil servants, they really don't have any idea how it works, and they just, you know, jump into something which they don't know, and then they need to know that. So that's and then the autonomy, as I said, it was the trickiest issue, because the government sees civil society as kind of overreaching, entering into the political domain with criticizing the government. So they say that, yeah, you are here to represent vulnerable people, and you are not here to criticize the government politics. And civil society thinks that, no, this is our job. You know, we are here to actually analyze the situation, not only, you know, to help you to implement what you already decided, but yeah, if we don't agree with the concept, we have to say that. And of course, this creates a lot of problems, and being political is a kind of accusation against many civil society organizations. They say that they are then not civil society, because politics is the job of elected politicians, and if you are not elected politician, then you have no room to do this. Of course, I, as a civil society, I don't agree with this, and because I think that it's the freedom of association, that people should be able to have a voice in policy making, and it's not just the privilege of a political class to get involved. And it was again very interesting that shrinking space not only happening in Hungary, so it's not the same level maybe, but in many countries, all of these countries, there was some kind of sense that there was a decline of engagement, or activity of engagement and trust between the government. So in many countries we had these stories that there was a kind of golden age before, and now it's not so good anymore, and we don't have that good relationship anymore, or maybe there is a new government, and now we are afraid that it will curtail liberties and cut the funds, and before it was more stable. So we had these stories from all countries. So it's not only Hungary with the very dark environment, but yeah. And yeah, I mean, in Hungary, many times, NGOs are directly labeled as foreign agents, but as I learned from our Greek colleagues, it also happens in Greece, like, that they, for example, with organizations dealing with migration issues, they are labeled and they are attacked because they say that you are serving Turkey or something. Yeah.
I'm an agent.
Yeah, an agent of...
It's the first time I say that. Yeah.
Ottoman agent.
He's now empowered.
Yeah, and again, autonomy also, has an influence on your prospect of funding. So that if you are critical, you have to navigate very carefully because you can lose your funding. So a lot of NGOs are afraid that, if I do not conform to the expectations and I fall from the line, then I may lose my funding. And we got stories even from Ireland about this, that some NGOs are perceived it as being punished and losing funds because they were too critical. Sustainability is a big issue again, that, most countries, there are some resource, some funding for service provision, but not on advocacy. And NGOs do a lot of work in the field of advocacy and also consulting with the government, but the governments usually consider it as a kind of complementary job for them. Like, yeah, this is good for you that you work for us, so we don't compensate you for this work. But if you would count, like I think in many countries, NGOs would count how many working hours they spent on participating in these different kinds of bodies, and that's like a serious job, I think. Even in the European Union level, the Civil Society Forum on Drugs, which is an expert group of the Commission, we don't have any direct funding, and people are doing this for free. So that's something not so good. But even some government representatives acknowledge this, so that I'm paid as a civil servant, but they are not paid and are often exploited. Again, it's also a competition for resources. So that in Greece, one official said that we have a pie and everybody wants to take a slice from the same pie. So there is competition among different stakeholders for funding. And in Hungary... Yeah, sure.
It's very peculiar because I guess that the person who said that, he or she is state-funded, and we're not taking. So I think he actually projects a dynamic that we have the monopoly, and we don't want others to interfere in that.
But
yeah.
We don't have a pie, but we have some cookies.
Okay, it's nice. It is space cookies.
Yeah. And of course in Hungary, where the services themselves are not very well funded, it's like we cannot even speak about sustainability. We also asked people how relevant you think the whole process is. So how relevant is it that you are involved in as a civil society? And this was like very. There was a great contrast between how the government perceived this and how the NGOs perceived it. So the governments had quite a pink, nice view or positive view about this process. They said that it's very valuable, we are valuing this, and we get relevant information from civil society. At the same time, civil society was very critical in the focus groups. So they said that we feel that our voice is not heard. So we can tell what we think, but usually the government will not act upon that information, and usually the decisions are already made, and we are just, there to, just to rubber stamp that. but so that the government representatives acknowledge that or recognize that it is important. But for example, in Finland, someone said that there is a very unhealthy closeness of NGOs and governments, so that sometimes they are called nearly governmental organizations because the funding is coming from the government and they become dependent on the funding for the government. So they are not really independent actors. And in Ireland, someone said that it's a very top-down approach to make policies. And a lot of people have lost hope that they can make a difference, so that you are not able to really initiate change. And in Hungary, someone said that we have used all kinds of advocacy methods in the past 13 years. We sent letters, poems, we commented draft laws, we called, we visited decision makers, we even fought among each other. We have done everything on earth, gave interviews in the media, but whatever we have done, nothing made a difference. So there is a frustration, and I think I felt this kind of frustration in every country, even if the situation is quite different. So we made a couple of recommendations tailored to the country's needs. For example, we recommend to Finnish government to create some kind of formal institutional mechanism to involve civil society. In Ireland, we recommend to strengthen the existing mechanisms and give a real, meaningful voice and support the networking activities in the civil society, because it came back as a topic. I think that networking was something which is seen by the government as dangerous or risky. And then in Greece, to again having a formal mechanism for dialogue, and also create client councils to involve more the community of people who use drugs. And Hungary is that the process which was abolished a few years ago, that which they should restore it. They should restore this drug council, regular meetings, and also restore the funding of harm reduction. So that's, I think, that was about the findings of the study. And what we were thinking with Katrin, that in this session we can open up to the audience. First, I would like to ask those people who are from the countries, so Ireland and Finland, Greece, and Hungary, if anyone wants to comment, and how do you feel about this, about the findings, and also my question is how you can build upon those findings to improve the situation. What do you think? How could you improve? How could you improve the dialogue and partnership with the government? Is that? And then we open up for everyone, and you can share your thoughts and experiences from your country. So maybe we can start with Tony.
Okay. And there are people watching online, so please use the microphone.
Sure. Hi. So Tony Duffin, based in Ireland. So just to talk about the formal structures for a second, we have a national drug strategy, a national oversight committee. I'll be attending it on Thursday. I'll explain why in a second. Under the national, as part of the national oversight committee, it has 6 subgroups, strategic implementation groups, which are responsible for actions within the national drug strategy. And I think, it is important to say that I was invited as a civil society member, to chair one of them, and which is great, and that one is alternatives to coercive sanctions for the possession of drugs for personal use. So there's 4 actions. I won't go into all that, but one of them is to help support the rollout of the health diversion program, which is planned. So people will be something similar to what happens in Portugal and other countries. So that's important to note, in terms of the relationships and the report has talked about strengths and weaknesses. The the other interesting piece recently was the Citizens' Assembly on drugs use, a deliberative process, a democratic process. So the idea of 99 citizens and an independent chairperson, so 100 people, looking for 7 months, looking at how we respond to drug use in Ireland, totally separate to the national drug strategy and the political processes. And they have come back with 36 recommendations. A report, they were published, and a report has been put together to go to government. That will be deliberated upon by committee at Parliament level, and then they will make recommendations to government. So there's still a process to go, but the next national drug strategy, I think it's been said already that will be very much informed by the Citizens Assembly. I think it's fair to say. So yep.
This is a new one, the Citizens Assembly. It's a new strategy.
It's a separate process. It's a completely separate process. Yeah. Yeah, so we would have a national drug strategy. All that is over here, but I think politically, it was at the last election. The government was put together, and they agreed between the parties that they would have this process, this Citizens' Assembly, because you'll know that drugs policy is hugely difficult. It's often moralistic rather than based on evidence. So the politicians basically pass it to the citizens to look at in a as objective fashion as possible. Now, lots of the online, you will see that some people are totally unhappy with the outcome of the Citizens' Assembly, and other people are very happy with the outcome. So it's still divided, But that is the process, and that's what's happened. In terms of civil society's engagement with the policy structures, look. There's always going to be people who aren't happy with the processes, and the working groups in Ireland reflect that. Equally, Ireland does have the structures in place, and I think that we're not far from having more meaningful. I think there is work being done at the moment to ensure more meaningful engagement. So that's good. I think it is drug policy is in that regard is a great example of democracy. Like when it's not working, it's a sign that it's not. Democracy isn't working. So what I mean by that is you've got in terms of you've got the elected officials, the politicians, the people that are elected. Then you've got your permanent government, your civil service, you've got your public service who are holding the purse strings, and then you've got civil society. And, between the push and pull of all those people, change happens. Drug policy change happens slowly. It's the only time I've seen it change fast is during COVID, when it was a real push. So drug policy, certainly in Ireland and in other jurisdictions, I believe, changes gradually. Sometimes there's gains and sometimes we fall back again. But that's just my rant about Ireland.
Yeah, but it doesn't
Okay.
The conclusions.
You want to?
Sorry. Yeah. Sorry, guys. So it doesn't fit with the conclusions of the shrinking space of civil society that Péter was presenting, even in Ireland. It's not a shrinking space.
It's debatable. It's debatable. You're going to have different perspectives on that. So sure, I have colleagues who will absolutely maintain that there is a shrinking space for civil society in Ireland, and then there are others that will talk about the structures as they are. I'm saying that I'm hopeful that we will have increased and meaningful engagement. As we move forward. But it remains, obviously time will tell.
And this is a qualitative study with perceptions. So we had perceptions of some people that there is a shrinking space. Other people disagreed with that.
Okay.
But that was clearly in Ireland as well. Okay, so maybe next one is Marios from Greece.
Okay. Is this thing working? Okay. First of all, thanks to remind me that there is an online So I can be careful to what to say, because I don't know who is actually joining in online. Yeah. So thanks for that tip. Uh, because I heard Tony giving the context, providing the context of the strategy. There was also it's a thing in Greece. There was a strategy about drugs and action plan, and it was never passed as an official document because it needed to be approved from what they are calling an interministerial committee. So it could be approved for many different ministries, like justice, public order, as they call it. Now they call it protection of the citizen. It's totally Orwellian title. You know, the police ministry is the protection of the citizen. The health department, blah, 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 blah. So that was the fate of the previous strategy. And then the drug chair changed, the new one came, they made a new strategy, and exactly the same happened. They made a strategy that never passed because the interministerial committee never met again. So, in my reading, this is intentional. It cannot be something else. Like it's the same mistake is keep repeating for like 10 years now. It can be a coincidence. So this is the context. Also, in the appointed committee for designing and implementation of the drug strategy and the drug policy in Greece, only state-recognized organisms can join. So civil society is outside of that. What exactly happened when the new drug chair, he's not new anymore, the former, the current drug chair called us to participate in one meeting, is that we had an agenda. So we decided to put 3-4 basic things as civil society organizations. And the number one thing on my agenda was the inclusion of the LGBT community, the queer community, in the services and the design of the services towards these people, because they're totally discriminated and there is a chemsex phenomenon that is rising, blah, blah, blah. So the representative of the police started shouting at me and threatening me in a Zoom meeting. And no one reacted from the committee, not even the drug chair. And because civil society organizations have very negative dynamics in Greece, then I was accused of because the policeman was furious. So I actually thought that this is a lost battle, and I don't want to interfere with that. Now, about the actual focus group, it's no surprise for me that state organisms perceive us as a threat, as something that they have to compete, as something they have to share the slice of the pie. Okay, on the other hand, in many, many different levels, as Positive Voice at least, we have a very good collaboration with them, especially with Okana. And they've been very helpful to many different projects. So it's a kind of, we help each other and we work in the field. So it's not that hostile. On the contrary. The other thing is that the gap is about perception, how we perceive harm reduction. The Greek state perceives harm reduction as something totally medicalized. We perceive it as something which is based on a peer-led basis, peer-led harm reduction. I think that's a problem. And this is why probably some people from the state organisms say that we cannot understand how they function as technocrats, as specialists, and decision-making, because they don't exactly know the community-based approach. Let's put it like that. I think what happened, it was very helpful. It's like, because in Greece, they tend to look up people who come abroad from Central European countries, and they are now correlation network is something recognizable after the expert meeting in Athens. Before that, it wasn't that the case, but now it's something recognizable. I think it was very good that we sat on the same table. We have this kind of conclusions, but we need, and personally, I need your help, your aim, how we can push this recommendation towards the government, like probably writing a common letter or whatever, but you know what I mean. It must be a joint initiative. It can't be like only Positive Voice and Marius and who the hell is this guy, like recommending to the Greek government, come on now, like you should do this and that. They will say, come on now, you know. So, yes, and there is a gap. There is a gap. That's my final statement, I promise. Because I can talk for hours, as you may know that. There is a gap between, we have services as Positive Voice for sex workers, for chemsex users, and also there's another organization for nightlife settings. So we are dealing with people who are, by definition, excluded from the drug-related services, from the drug services, because the drug services are designed for a person, let's say, in my profile, heroin, cocaine user. Okay, I'm a former user, but Greek-speaking, white, heroin user, opiate user, benzo user. They're not designed for these groups of people, for sex workers, chemsex, nightlife setting, and chemsex, we include all the queer community as well. So the problem is that if you exclude the organizations that they have services for these people, you exclude from the design and the formation of the drug policy entire communities. So the drug policy by itself from Greece, it's very, I don't remember the English word, but it's not inclusive. Let's put it like that. It must be much more inclusive. It's stupid for me that they don't call us to the same table to express what is happening with the chemsex. It's a rising phenomenon. People are getting HIV from these practices, and other people developing mental health issues from crystal meth. And this is totally under the table. Okay, I hope I will survive that. I'm talking to the camera, and I say, thanks for the opportunity given.
Thank you, Marius. And I think the presentation may be a bit darker than the real situation always, but because there were also positive outcomes from this study, like for example Greece, especially I think this introduction of take-home naloxone and the change of naloxone regulation in Greece was a very positive experience, which civil society was very intensively involved in making naloxone available. So in the report, of course, these are also highlighted. And I could, for example, not mention some concrete examples from individual countries. In Finland, you had this action for the drug consumption room in Helsinki, and that was also very interesting. So now I ask Kim to comment, and maybe you can also talk about that action which you do.
Thank you. And we have a finish line here at the back. And I think that someone else is better about talking about their action on DCRs. Maybe Juha can say something about that. But for all around about this study you have made in 4 different countries, it's really important. And for us in Finland, it's important because just because of the recommendations that we are lack of the instrument that the civil society is taking part of. But it's kind of divided. In some parts we are taking along, and in some parts we are not. And the big problem also is that the evidence-based procedures are not taken seriously. For example, drug-related deaths. We have a group of experts in Finland. They are official authorities and civil society experts also. And we have made a list of 12 different kind of toimenpide? Action plan, how to reduce the drug-related deaths. And there are some of the actions are taking more seriously than the others, and so that they it's not pushing forward as a whole action plan, but some picking up some easier ones only. Not, for example, decriminalization or drug checking and so on. They just leave behind. So the evidence-based thing is crucial for us. But Juha can tell something about the action plan on DCRs.
Yeah, hello everybody. First, I'd like to say something about the situation, like the space in civil society involvement. There has been, like, we have a left-wing government at the moment in Finland, right-wing government. Sorry. So I wish so much. We have a right-wing government in Finland, and it's a real threat to many of the civil society involvement. So the funding has been set to go down in few years, and it's a real fact. So it's not like just a perceived kind of way of thinking. But about the actions of the DCRs, we've actually had two in Finland. One of which was this unlawful situation that we created a DCR in a park, and we invited people to come and make news stories about it, and we had the tent up for like an hour or something until the police came and tore it down. But we had very, very good experiences about the that's really annoying about the news press and the way that it was perceived in the Finnish news, and it was civil disobedience, like action, but we didn't get fined or we didn't get charged. So the next day, when the police came up to it, they told us that we won't have to suffer any convictions about that. But also we had a little later on from A-Clinic Foundation, we had a simulation of DCRs, which we invited politicians and press to, and it was like 9 hours of constantly talking to politicians and saying the same things over and over again, how DCRs work and what they do and what we do in the DCRs, and it was really I think it was really satisfying. Like there was this one right-wing politician's help that came and actually kind of apologized when he left, that he didn't know enough of the DCRs before he came to visit us. So there's plenty of things that we could do differently also in the civil society movement, I think, especially when we talk about DCRs and what they really actually are. But civil disobedience is the only tool we have at the moment to actually act upon this thing. Yeah, sure.
Thank you. So I'm the person behind the second simulation project that we did, where there were 3 NGOs putting up the simulation, and we talked about a simulation in the actual meaning of a simulation, meaning the people we invited being in the politics and in the media, they actually got roles. We wrote them cases from our own customers. So they acted to be a customer in a DCR. So they came in and they actually went all the steps that you go in a DCR, so that we could give them the experience how you actually really are seen in a DCR and how that works. And that seemed to be the key to actually get the knowledge to them. And like also Kim said, I think the biggest thing is that Finland, we lack of knowledge. The people who decide about things don't have the knowledge to decide these things that they should be deciding on. And that's something where kind of, well, sometimes it's a bit hopeless because, come on, I don't know, we voted them to decide for us and then they don't know anything. But yeah, that's how it goes. That's democracy, they say. And but there's still there's kind of like, that's where we should as people be even better to give out what we actually, we're living in a bubble, I feel, and we're not good enough to tell what that bubble actually, what kind of information we have. We're not good enough to tell that how that would work to other people, so the people who don't live in that bubble will get the information they need to make a decision to make that life better for those who they don't see in their own life. And so I feel that there's a point that we all should be kind of like considering to how can we do this better.
Thank you very much. And now the floor is, I think, open. So, sorry. Yeah, you're right. I forgot. So, Robert or Gaba, do you want to add something on Hungary?
Okay, so very briefly, because we covered the Hungarian context in the parallel session, so just like two things that. So first, like, just resonated in me that so the civil society have to be political, because so there is no, I don't know, change without that. So we have to be political, because that's the same where drug strategies and policies are born. So we have to, I don't know, we have to be political. Yeah, that's it. And the other one thing. So the consequences of this kind of context where there is no real involvement of civil society, it is hard to involve civil society when it happens. So with the Budapest drug strategy, we did the research and tried to involve professionals, and it was really hard, especially from the treatment side or from the healthcare system, because they are not really in this conversation, or they feel they are, or it is a bit different part. So we had to work hard to get their opinion too. So yeah, and what was the other thing? Yeah, I think these are, yeah. So yeah, that's it.
Good. So, anyone else would like to share their experiences or stories from their own countries? Catherine, you want to say something? Okay. We have Portugal here, so.
Yeah, I think what Mario said, and also what from the Finnish group of people, what is important is indeed that these case studies are not finalized now, but there is a kind of follow-up. And I think it's extremely interesting to hear about the simulation and about the DCR flash mob, I don't know how to flash mob thing. But I think these are good practice examples which really could also inspire others, thinking out of the box, not only writing letters or statements or recommendations, but probably really think about what kind of arguments are really working for policymakers, because it's not always only because they don't want to listen and because very often they don't want, and very often they do have their own opinions, but very often it's also kind of wrong idea. And also for public, You know, if we talk about stigma, how to reduce that. So I think it could be a way. I mean, we would be very willing to support a follow-up per country or per city, or to see what needs to be done or what could be done to follow up. And it doesn't necessarily need to build up on the content of the case study. We could also say, okay, let's focus on DCRs, for example, in Finland as an example, what would work, or see, for example, I would, for example, think when I think about Greece, I would think it would be great to already have a more structured dialogue also with the state organizations, Organa and Kethia. You know, this already would be where peers could have a regular, where service users could talk. You could think about all kind of other actions, but I don't go into detail, but I think this would be our responsibility now probably to follow up, not only say, okay, we have done this, we have collected the info, we know what's wrong, but now we need to follow up.
Yeah, you mentioned that people who are making the decisions in Finland, they are not informed by the evidence, they don't have the knowledge. And, you know, to change this, you need to have a table to sit where you can sit down with this decision maker. So that's why we think that this kind of formal structures are so important, because they provide you a permanent framework to have a dialogue with the government. If you have that opportunity, then you have an opportunity to educate your policymakers and also maybe police and other actors. But if you don't even have a table, then this never happens. So I think when we did a video with István on the Civil Society Forum on Drugs, the title was "The Right to Sit at the Table," and it's like, I think it sums up like what civil society really demands here, at least to have a table. And even if you have this table, just like in Ireland, maybe some people are still not happy with it, that they think that they are just used to rubber stamp decisions. But I think it's like really it makes a difference if you have a platform, and yeah, I'm really curious about the situation in other countries. I see, for example, Portugal here and Romania in the background, and so maybe do you want to share any stories?
Yeah, I will not share stories because we have some of them. But I want to add something about, you know, the evidence-based approach. I would say that normally decision makers, they don't take any kind of decision based on evidence, as far as I know, you know, from my experience. But they have something. They are afraid of losing power. So if we are capable to demonstrate to politicians that they will not lose power with a DCR, for example, that maybe they can gain even more power in the future, meaning more voters for them, so maybe they can be convinced to open this DCR. So I think it's more about, you know, the political perception of power, maintaining power, losing power, that is, you know, the key factor to talk with politicians. I don't know, you are a politician, maybe you agree with me.
Yeah, I think it's an interesting thought, because it's always been said to me that there is no votes in drug policy. You know, that's been said. Like, I'm just saying that's been said, and your point is to work within that. That's your point. Is to address that and to, you know, try and help. Yeah.
Yeah, because, you know, I can imagine that homeless people doesn't have, you know, let's say the right conditions to go to vote. They simply don't care most part of the time. But I would say that the neighbors, for example, the citizens, the families, they vote. And so if you work with that, if you address the fear, so that is always, you know, present in a politician when he wants and needs to decide about drug phenomena, if you address that, and if you are capable to bring to him, you know, some kind of, let's say, peaceful foresight, you know, future for him, so a kind of optimist scenario about the future and about your, you know, policies that you're going to implement based on evidence. And if you can bring, you know, for example, evidence coming, or not evidence, I would say case studies coming from other countries or other cities, so then I think it's more easy to them to go and take a step forwards, honestly. So when we were, bringing, for example, to the Portuguese Parliament or to the government, or even to CICAD sometimes, evidence, they were like, yes, yes, yes. But when, for example, in 2013, we took research about the outbreaks of HIV in Athens, because they were, destroying and dismantle all harm reduction services there, and we went to the parliament and we appoint with one slide only the outbreaks, like raising like this, in a few months. So then the members of the parliaments, they were very scared with that, and they say, okay, we can have a problem in the future in Portugal because of this. So let's once again come back to harm reduction services and put some money there. So.
Yeah. But I think Portugal is also interesting because Portugal is used as a kind of good model all around the world, as like the good drug policy model with the decriminalization and investment in harm reduction. At the same time, when we were filming in Portugal, we saw that the situation is far from ideal. Also the relationship between civil society and government, and that Portugal created a legal framework for example, the drug consumption rooms, which was empty for several years without implementing anything. So it's like, how come that? It's like it was always kind of curious to me that you had this legal framework and you had this big change around 2000, and it remained empty for so many years, and civil society could not really have any impact on that, right? So.
Well, that's a very good question. And we have lots of thinking about that, and one of the things is that when those people designed this decriminalization model, this was designed by an expert group of people that were very progressive in the way they were making scientific research on drug phenomena. Some of them, they were our professors, Martin and I. And Martin, now you have worked with some of these professors in the past, and so, but they were people that were learning from the Dutch experience, from the Swiss experience, and so on, and they were let's say protected by a particular kind of political people, so politicians. So they were politicians with a very progressive and radical mindsetting, because these were the people, these politicians that were raised on during the 60s and the 70s when we had our revolution. So these were people that were raised under this, let's say, left progressive environment, philosophical environment. And so they were quite open, to do something different for society and in society, with the society. So this was very interesting to see. But at the same time, because we were coming still from a dictatorship, as you know, of almost 50 years of dictatorship. Let's say that the people that were in charge to implement this new policy, they were people that were born in this dictatorship, that were educated and trained on this dictatorship. And of course, I think that most of them, they are honestly open to do different things, positive things. But at the same time, they were raised in a kind of fear context, once again. And they were raised in a very conservative, context, meaning that to them, this new political approach, it was too much, it was too radical, honestly. It was quite forward from the mindsetting of these people, and they were not used to that. They were used to work with a abstinence-based model, as we know, because they really believed that to treat people, to clean people, was the main purpose of the state when we came to drug policies. And of course, when we appeared, the civil society, saying that no, there is different, there is different approach. We can live with different situations. We cannot clean, everyone. So there are people that are capable to manage the use of the drugs. There are people that are not capable. But in spite of that, we need to give them, dignified conditions so they can live and behave as citizens. And they need to belong. They have the power and the right to belong to the city. So to the bureaucrats, this was a little bit, too much radical, because this was not written down on the laws, it was not written down on the norms, and that was quite new, actually, for them, because this was considered to be a kind of subversive approach, something like that. But I do believe that was one of the main obstacles, so a cultural mindsetting, of people that were in charge to implement the law. So that's why when I'm with these people from IDPC and so on, and sometimes I get a little bit bored, like, whoa, when they say, if we change the law, we change everything. I say, no, you change the law, and then you have a huge, way until you can change reality. It can change, the way people thinking and the way people behave. So law is only the first step, and there are countries where there is no decriminalization law, and still they have very good harm reduction services, or cities like St. Petersburg, for example. No, it's not amazing, but still is something. And we are talking about Russia and Putin. So, yeah. Sorry.
It's also interesting, that in each, Tolstoy has this saying, that each happy family are happy in its own way. Yeah. No, it the same way, and each unhappy family is unhappy in its own way. So that you can be unhappy many ways, and you can be happy only one way. And if you go to the countries, you will see that you have these unhappy, dysfunctional families that went wrong in different ways, and there are sometimes. It's interesting, also to see like where are the blocks in this process, and sometimes these are people, and that sometimes in the system there are people with a big power, decision-making power, and sometimes NGOs also feel that they can't really reach the real decision makers, like like the minister level or something. But if they are addressing the high level, usually they give back the task to the lower level. So they always end up speaking to the same people, and they cannot really overcome this. So they always end up speaking to the lower level civil servants. And it's also interesting for me that in every country there are different blocks. For example, some countries the block to implement harm reduction is like Minister of Home Affairs and police. But in other countries, like in Romania, there is the Ministry of Health, which is like that they have been struggling for like decades to get some funding from the Ministry of Health, and it's the Ministry of Home Affairs which has the drug agency, which is quite okay, or at least supportive, but it's the Ministry of Health which is not. Maybe Alina, do you want to speak a bit about Romanian?
I just don't want to complain, because it seems that at all the meetings, Romania complains about the government, and I'm also fed up with this. Personally, I'm very disappointed with how the government has handled the drug use problem since, in the last 25 years. However, I think that somehow the failure of the government is the failure of the civil society. And I cannot dissociate the response of the government from the response of the civil society. And I'm saying this because since 25 years, in the last 25 years, there are only 2 organizations active in this field from many reasons. And we tried, and I always listen to to how other countries have approached governments or have introduced or pushed for changes in legislation, in the development of services. I think we've done almost all of them in the country, so I don't know what else to do. But I think we haven't perhaps very good in managing to stay united with other civil society organizations and to make alliances. the pie was mentioned by somebody. The pie is almost inexistent in Romania. There is very, very little money put by the government in supporting any kind of civil society activity or service. So there is, I don't know how to say it in English, it's more than a competition, it's a fight. And this fight is also reflected in, you know, in the response to a certain a situation. Yeah, so I think, in my opinion, I think we have to perhaps, instead of being so aggressive with the decision makers, perhaps being more aggressive in creating, you know, alliances with other civil society organizations, not necessarily the ones involved in harm reduction. As I said, we are only 2, and as in Hungary, no representative from the people who inject drugs. There is no organization of people who inject drugs. So this is a failure, in my opinion. It's not the failure of the government that hasn't created this organization, is the failure of civil society. So in a way, we are responsible for what we have overall. So for us, because we internally in the organization, we have had a lot of discussions on how to design, how to develop our advocacy agenda for the next couple of years. Because the context has changed I mean, it is getting worse. The situation is getting worse in the country. So we are responsible for the clients. So we have to do more. More, not necessarily to intensify the dialogue with the government, more to do other things. So I think this would be, I mean, working with other civil society organizations, going to approach, for instance, organizations active in the field of mental health, and you know, creating allies in this area, or from other fields working with children, because now drug use, for instance, in Romania, drug use and abuse are becoming very common among those under 18. So I think we have to practice more this collaboration and to be more, let's say, inclusive, instead of, you know, keeping our own agenda, and perhaps trying also to embed harm reduction into a broader topic. Yeah. Otherwise, we do have like everything in the country. I cannot complain. We have nice strategies, we have nice structures, we have everything. But still, when you look at the result, it's like we have almost nothing. So personally, I think I feel responsible for what we don't have, and I'm trying to somehow to, I don't know, to figure out how to reshape what we do as civil society. Yeah, thank you.
Thank you. That's something to digest, right? Sorry?
Beatrix had a hand up.
Beatrix. Okay, just a moment, because Jose was already. She was first. Okay, sorry.
Thank you. I actually have a comment from Len Jeffries from Euroinput, who's watching us online. And it speaks to your last points as well, about civil society and NGOs, how we could do more to include drug user groups in these civil society mechanisms. I'm trying to do justice to Lynn's comments. Sorry, 1 second. It's about how drug user groups and networks already, being a criminalized group, bring on fringes of criminalization, there's also opportunities to take advantage of that, and the sense of really providing a frank look at advocacy. So that's also kind of the added benefit of including drug user groups. And because also drug user groups are on the fringes, if there's no support from general civil society for these groups to be included, it's even more difficult. But I think without the state funding, without any access to these spaces, and also we have networks like Input, who can act as the umbrellas to facilitate these connections with the drug user groups. And I think we've also seen, the meeting you've had on Sunday with the Budapest participants. There's possibilities to involve drug user groups in different ways, but also a comment from Lynn is also sometimes support from other civil society organizations can look like providing a room to come together and talk for 2 hours, but also provide lunch and drinks in the meantime. And that allows also better participation for people.
Thank you. José, you want to?
Very briefly, just to say that first I agree with you. I feel very happy, with my dysfunctional and unhappy family in Portugal, and so I'm quite okay with that. The second one, to get it a little bit more clear, is about that. Imagine that I'm a medical doctor in Portugal around my 40s, and I was trained to say that drug is madness, leaves people to death, and so on and so on. And from night to day, a new law appears saying that drug is no longer a crime when you use it, and it could be treated in a different way. I am the same still medical doctor, and I have a new law that is telling me the opposite of everything that I was educated and I was believing into during 40 years. So that was my point. I was not very clear in the first sentence or my first, speech. So just to imagine that changing the law is one thing, changing, the mind of a person is another huge thing. Sorry.
Yeah, thank you. About the community involvement that also come up in the research, and problem is, that in some countries there are no real representation of people who use drugs. I think in Finland you don't have any active groups now. In Hungary we don't, so we are now starting to do something. So it's like, it's something, you have to invest in your countries if you really want to have a lively dialogue, I think, because I think this kind of community, look at, for example, if you look at the north part of Europe, and if you look at Norway, which had also very abstinence-based policy before, and what changed the situation is it was really like a community-driven advocacy process. So they had a very strong community voice in Norway. And also in, I think, Greece, whatever happens, I think the communities were really strong. They had a strong voice. Like now, there is a drug consumption room. There is a 6-story shelter which was open during the COVID. And as Tony mentioned, actually, it also was a recurring theme in the research that COVID opened up some opportunities for cooperation between governments and civil society. But also there was a frustration that after the COVID, they just were not. The government were not so. Yes, so it's like the door sometimes just closed after COVID, but some things remained. Like this shelter in Greece. So sometimes the crisis opens up the doors when there is something, a crisis situation happens, and then decision makers are forced to come to the civil society because civil society knows what's really happening on the ground. You wanted to add something to this?
Yeah, actually. So what about the other stakeholders? So people from Finland, they talk about journalists, I think. So, but did in your study look for the importance of other stakeholders like the media, for example? No.
No, we did not cover. I mean, some of the focus groups mentioned media as an important player, but we did. I mean, in the framework of this study, we didn't have time to cover everything. But Tuka, you want to say something?
Yes, going back to your report and your recommendations, I wasn't here in the very beginning. Maybe you touched on this also already, but do you have some sort of plan or even strategic plan how to communicate your recommendations to the decision makers? It would be maybe better to come from a European body or organization than from us.
Yeah, I think Marios mentioned the same. That and yeah, that's something I think we can take home as a message from this group, that we need some kind of structured communication to the governments of in these countries. Although in Hungary it will be very one-sided, as I suppose, but because even they didn't come here. So but I think in the other countries, in Ireland, in Finland, and in Greece, yeah, we have to sit down and discuss. That's actually in Brussels. When was it? 3 weeks ago, we were at the CSFD, the Civil Society Forum on Drugs meeting, and we had a working group meeting, and new ideas came up, like what to do. And some people said that in these countries there's needs for some kind of follow-up meetings. You know, like when the people from the two sides, they can sit together now and discuss this. So before they were separated in two focus groups, but now maybe there can be one joint group to discuss these findings and recommendations. So, and maybe correlation can facilitate or support. I mean, probably if like Marios and Tuka, you said that it's like more useful to use the international organization because it's maybe seen as more neutral or whatever, or outsider. Maybe that can be a very important role for correlation and legit. Yeah, I mean, you need to have self-confidence, Marios. You are also a legit player, but
not in the eyes of many people.
Yeah, I know that, but I think, yeah, I mean, I think that.
Slavish mentality.
Yeah, I know.
Like slavish mentality, that people come from Central Europe and Greeks are like, wow. And when we say the same thing, we say this is not happening. Come on.
Okay.
Get over it.
So Central Europe, you mean like, not like Tony from Ireland? Okay. Okay. So to wrap up, we will follow up. The study will be published soon on the correlation website and also on Drug Reporter, and we will discuss how to communicate the findings to the governments together with correlation team. And yeah, we are very happy to work with you in the future on future projects, because we want to follow up this or continue somehow this civil society involvement. Maybe not the same studies, but maybe some training events, or we have different plans, and it depends, of course, if correlation will survive or have a funding. But we hope we hope it will. So thank you so much for being here.
Thank you.
Thank you, Péter.